Did you recently get out of the shower and notice that you had a lot of hair in the drain? Or did you comb your hair and notice that you had a tremendous amount of clumping? You might have a condition called telogen effluvium, a very common hair loss condition that impacts many people. I know that any hair loss can impact you emotionally. And so what I want to do today is first and foremost explain what this condition is all about and give you hope and treatment options to address it. Telogen effluvium is a temporary hair shedding condition that usually lasts up to 6 months. Now, it can last longer than that, and then it becomes chronic. But I have seen all telogen effluvium cases resolve on their own for the most part. Sometimes medical therapy is important, and we're going to discuss that. I do want to emphasize I have seen more women impacted by this condition than men, and we will discuss that. But the first thing I want to really talk about is I want you to understand the hair cycles that we go through, because then you'll have a better appreciation for why you have this hair shedding to start. So there are 3 cycles that our hair goes through. Anagen, which is the growth phase, catagen, which is the transition phase, and telogen. And the telogen phase is the resting shedding phase of the hair. Now, 90% of our hair spends time in the anagen growth phase, and 10% spends time in the telogen shedding and resting phase. Now, it's completely normal to lose up to 100 hairs a day. We're born with about 100,000 hairs on our head. And so if you lose 100 hairs a day, that's normal. Now, what happens in telogen effluvium is that we go from 10% in the telogen phase to now 15 or 20 or 30% in the telogen phase. So more of our hair is spending time in the resting shedding phase, and less of our hair is spending time in the anagen phase. And so that's why you're having this significant hair shedding. But it really, for the most part, is temporary. The cycles are kind of off balance, and we're going to talk about why these cycles are off balance, but now you're going to have a better appreciation for kind of what's happening to your hair. More of it is really in that telogen phase. It's not uncommon for a patient to come into my office with a brown paper bag filled with hair. It's traumatic to lose that amount of hair. I totally understand, and I want to kind of walk you through why this might have happened to you. I want you to know that this condition is not genetic. The number one cause for hair shedding, telogen effluvium, is stress. It can be the recent loss of a loved one, a breakup, a divorce, the loss of your job. And this could have been an event that happened 3 to 4 months ago. But that's not the only cause. You could have recently changed medications. You might have recently changed or stopped taking your oral contraceptive. It's also very common to see this if you have thyroid disease or if you have low iron. If you have recently gone on a medication called Wegovy or Ozempic where you're having significant weight loss, this can also have an impact in terms of having hair shedding. And a very common thing that I see is with friends and patients that are pregnant 3 to 6 months after their deliveries, they have significant hair shedding. So that is also something that is commonly seen. And the big takeaway is that any stressful, emotional, psychological impact to the body, not just mentally, but physically, like delivering a baby or losing a significant amount of weight, can have an impact in terms of having hair loss. Now, I want to be honest with you. If you do nothing, your telogen effluvium will resolve. But I do want to go over options that you can explore to help speed up the process. First thing I want to emphasize is do everything you can to decrease stress, because if you can decrease your stress levels, that is going to have a major impact in allowing you to get new hair growth. And that was probably one of the major causes for why you had this hair shedding to start. If you have thyroid disease or low iron levels, those need to be addressed. Eating a balanced diet is important in zinc and iron. If you want to really identify any nutritional deficiencies that you have, you can do genetic testing, which is essentially a swab in the mouth, or you can do blood work. And this could help identify where your deficiencies are, so then you can take supplements or vitamins. And there's a lot of great companies now that offer hair vitamins. They don't have to be hair specific vitamins, but these hair companies do focus on identifying nutrients and vitamins that we are low in. And so that is also an option. Another option is to use Rogaine or minoxidil. And as a woman, you can use 5% men's minoxidil, 5% men's Rogaine. I have an entire video dedicated to this topic, and I really encourage you to check it out. But this is also an option. There's also a product called Foliflow, which is a plant-based stimulant that can be used during the hair shedding that you're experiencing, and it works really well. It's essentially a spray. I'll drop the link below where you can get it on Amazon. And there's also the option of doing PRP, platelet-rich plasma therapy, which is an in-office procedure that uses your own platelets to help stimulate hair growth. Now, I want to emphasize something. If you do nothing, your telogen effluvium will resolve on its own. Everything I'm going over with you are ways to kind of help stimulate new hair growth. And they're ways to give you confidence that your hair is going to come back, because it will come back. If you have any further questions about telogen effluvium or why you might be experiencing hair shedding that I have not covered, please leave your comments below. I do everything I can to address your questions, and I want you to really feel comfortable as we grow this community that you can trust me and my father with your questions about hair loss and plastic surgery, because we really want to come along with you on this journey so you feel confident. And so that's it. I hope to see you in the next video.